Hello again. This is Dr. Lambrese, and we're talking briefly today about your upcoming assignment on emergency preparedness. One of the things we learned from the COVID-19 pandemic is how poorly prepared we were to deal with all of the issues related to responding to a pandemic. We had the issues of supply chain, we had the issues of deciding the extent that we had technology available for the isolation that occurred. We had challenges getting medicines out, running through the test process. We had the politicization of the pandemic issue as to whether it was real or not, and the seriousness of it. We had large numbers of deaths. We had deniers. We had every possible combination you could think of. When you add that to what was perceived by many as inconsistent guidelines coming from the Centers for Disease Control and government advisors, you can understand how the perceptions of the pandemic and the response aren't necessarily a positive reflection on what's possible. The reality is, in preparing for a pandemic, you have to make sure all the foundations are in work. What's the quality of your hospital care? What's the quality of your insurance premiums? What's the quality of your stockpiles, of all the things that get to be needed in the process of that? And one of the challenges that always comes up in dealing with an emergency that hasn't happened yet is most people are so concerned about day-to-day life and day-to-day activities that it's very hard to get them focused on things that may or may not happen. But if history tells us anything, it does repeat itself, just like the Spanish flu in the early 1900s. Now we had the COVID-19 in the early 2000s, and that's continuing with the evolution and the change in the virus itself and the need for constantly improving the vaccination routines and things of that nature. So how do we get ready for those things? Some of the issues that came up was what's the role of the federal government? Did they take a dominant enough role in putting things together, act as a clearinghouse, and help smooth the transition? Or did they say that's a state issue and let the states compete between and among themselves for scarce resources? What about the monies that were spent? Oftentimes that went to corporations that have never been involved in any kind of medical device in the past. And how are those decisions made on who gets funded and who gets funded? What's going to be the extent of any attempts to try to learn the lessons? Or are we soon going to forget about the next pandemic coming along and leave that in the hands of a few? One of the challenges CDC faced is, as we all know from science, the more data you collect, the more accurate your predictions can be. And if that's not explained properly, it's easy for people to feel that there was wish-washing and flip-flopping and backtracking on all of the information being put out about how best to respond to the pandemic. And then you had those who believe that we don't need to follow the science, we can have home remedies that make it work. And the problem is, in most cases, we tend to see the excesses, not the failures. And that's the problem. Or one or two people try something outrageous that tends to work, and there's a new solution, a new treatment available. And when in fact, they may be only two of hundreds that tried it, and they're the only two success stories or the only two stories about which we heard. You had the challenges of going on about the medical staff, the medical professionals, and the burnout rates they had. We had issues of education and how the education system could change and alter its track during a pandemic when people had to be isolated. We have the ongoing challenges of mental health. We have the ongoing challenges of vacancies in education, all of which are wrapped up into this notion of pandemic preparation and how do we put ourselves in the best positive position to deal with the next big event, and it will happen. We live in an environment of immediate transportation. The idea of diseases taking months to make it from one country to the next are a thing of the past, because I can get on a plane in Washington, D.C. in the morning, be in Beijing in the afternoon, and then be back in Washington or California the next day, or whatever the transportation might be, whether it's coming from Europe or Asia, South America. Instantaneous transportation makes it much more difficult to track and control infectious diseases that may come along. You add to that also the challenge that we have with bioterrorism, and to what extent might these be intentional releases of viruses, bacteria into the environment in a way to promote terror and confusion and mistrust, plus cause death. And all of those get to be interesting concerns when we talk about preparing for any large event, but especially one that has medical connotations. about 25 years ago, a study was done here in South Carolina talking about the digital gap, the fact that large portions of the population were not connected in any meaningful way to the internet. Look at the challenges related to that. And oftentimes, when we think about pandemic, we look at it from purely a medical perspective, but the reality, it affects every aspect of life. What about the health risk to those people who were considered essential employees? Those people that had to work, had to go to the office. We saw the big divide in education in terms of opportunity and occupation, where a lot of blue-collar workers could work at home, stay at home, and not have to be out and about and risk contagiousness and risk contracting COVID. Where the essential workers, again, primarily lower paid, lower socioeconomic jobs, were required to show up every day to provide for our comfort. And this is perhaps another example that we talked about with the ones who walk away from home loss, is people having to do the dirty job to improve our quality of life. And imagine what would happen if an epidemic had hit a particular department store or grocery store or agriculture producing. How would we deal and respond to those shortages? And unless you think that's not a great possibility, look at the recent shortage that we had in baby formula. That was in some ways a manufacturing, but also a supply chain, which is another thing that we didn't necessarily think about in the planning. With the supply chain, what would be the impact of reduction in stevedores, reduction in trucking industry personnel, the reductions in economic environment related directly to the pandemic and the people's fear of being found contagious or being around people who might be contagious and risking their lives and their livelihood in attempting to do those kind of things. So there's a very complicated issue in dealing with pandemics, and we need to think about these things before the next one comes along, not wait until it has happened. So that's a lot involved, and so your text goes into a lot of issues related to pandemics. The other one that we'll talk a bit about is the unequal distribution of access to healthcare. We saw a lot of minority populations were very, very much more impacted by COVID-19 and the pandemic because of lack of access to adequate healthcare. So there's a lot of issues wrapped up in this, but it's again one of those things that if it's happened once, it will happen again. And we need to come to some understanding of the basic relationships between the federal government, the state government, local governments, what kind of networking we can have in place to address supply chain issues, what kind of issues we can have in place or policies we can have in place that address employment issues. What kind of issues, what kind of policies do we need to have in place to ensure some minimal ability of the country to continue to move forward in spite of a health disaster, a health emergency that makes it difficult. One of the other after effects that you see from coming out of COVID-19 is this massive resignation, the resignation generation, people realizing from the pandemic that there are other values in life than just working. So how do we balance all of those things together? Some of those issues, those that are raised in the readings for this week. So have a look-see. What do you think about those things? What can be done? What do you think the best way is to plan and be prepared for the next pandemic so that we can minimize the impact that it has, not only on our health and the healthcare system, but on our employment, on our family, on our children, on our long-term mental health. A lot wrapped up. Have a read. If you have questions, by all means, let me know, and we'll look forward to reading your papers. Have a great week. Take care.